We have team coverage tonight on Governor Hogan's announcement today. WMAR-2 News' Eddie Kadam standing by with a look at how small businesses are handling this. But we want to start with Ray Strickland, who's live in Baltimore tonight at the University of Maryland Medical Center. And Ray, you talked to a COVID-19 survivor about the state's new strategy to care for all of us and to save all of our lives. Tell us.
Yeah, Jamie, this woman was critically ill after she was diagnosed with COVID-19, but she did recover, and she says that's all thanks to the hospital staff who took great care of her. Now she says that they know more about the virus. She's hoping it will give people a better chance to survive.
The whole process was terrifying. I have PTSD.
Cabria Newkirk is a COVID-19 survivor. Newkirk was in the hospital for 2 weeks in April. She was put on a ventilator and also placed in a medically induced coma. Months later, she says she's still having problems.
So I have to actively keep exercising my lungs. I have to do a lot of breathing exercises on a regular basis to keep my lungs strong, because it really did take a toll on me health-wise.
Newkirk describes the second wave as terrifying. She's hoping hospitals are better prepared and that no one goes through what she did.
I have felt the impact ever since. It's been difficult for me.
Medical experts fear the fall surge may be worse than the spring. Over the past 2 weeks, case numbers here in Maryland broke records. Hospitalizations are also at levels not seen since June.
Too many of us have become numb.
To slow the troubling spike, the governor announced restrictions that included suspending visits to hospitals and nursing homes. The health department is also issuing a surge order to allow hospitals near or at capacity to transfer patients to other hospitals. The goal is to help facilities that may be overwhelmed with COVID-19 patients. One of the state's top doctors, Dr. Thomas Galea, called the plan wise and timely.
This is about getting the right patient to the right place in the right amount of time to receive the correct level of medical care.
Dr. Scalea also pointed to lessons learned from early on in the pandemic. He says hospitals are more prepared and now have many tools in their toolbox to better treat patients.
Been doing this a long time, and I don't remember learning this much about a single disease over such a short period of time.
Now that they have this transfer order, I feel like more people will be seen. I feel like there should be more survivors.
And another note about that transfer order, Dr. Thomas Galea said hospitals would normally have to look for beds within their own medical system. Now he says with the phone call, they could find a bed anywhere within the state. And he also said, again, they're hoping this could help hospitals be put in a better position to deal with the surge of COVID-19 patients. Live in Baltimore, Ray Strickland, WMAR-2 News.
All right.